So, other pain points that you see, you mentioned this whole idea of the cycle and every year having to evaluate new devices, and you talked a little bit about international. What are some other interesting pain points that you've uncovered?
Software updates, that's the big one. A
Yeah.
lot of these companies, they don't have any regard for the use case of the device, right? They have a population of people that are buying the devices, most of whom are buying them for personal use. And they want the latest update as soon as it comes out. Like I said before, the emojis, right? Everybody wants the latest emojis on their iPhone. But when you're dealing with a healthcare company where this device is critical to some function, whether it's a glucose monitor or it's a heart monitor or something like that, you have to take that into consideration. So we actually work with our customers to provide them with the test updates, to work with them on an update schedule that fits into their calendar because of that.
And so, a lot of people, when we started this call and to start discussing this topic, we talked mostly people think about smartphones, but let's go into some of the other devices that social mobile is involved with. I understand you do sensors, wearables, tablets.
Yeah, all of the above. We have a base platform that we utilize that can be spread across different form factors. So when you have customers that are looking at C6 handset, right? 6-inch handset, we also have a wearable that's built on the same platform that they can actually use that if there's different companion apps and things like that that they have to run, they can do that. There's a couple of really exciting things that we're coming out with. We're coming out with a hotspot, 5G hotspot. We're coming out with a 5G dongle. This was something that we were looking into, especially in the healthcare space, to be able to plug into things like dialysis pumps and hospital beds to make them connected on a private network. So these are all different ways that we're taking the base technology and streamlining it in a way to come out with more products to help serve the enterprise need.
And it definitely highlights our ability to go into really complex environments and understand that there's really a lot of moving parts and not, again, not forcing a hospital system to say, hey, here's your handheld. Let's try to make this work in so many different ways. Whereas, is there a better way to do this? And when you start looking at wearables, it does allow a larger range of motion to actually utilize the technology in ways that you can't get from just a tablet or a handheld.